Okay, so I think we'll get started. My name is Sean Menard. I'm the City Councillor for Capital Ward, and I'm so pleased to welcome everybody tonight to the inaugural Older Adult Forum in Capital Ward. We're going to be doing a 120-minute town hall to increase awareness and understanding of the issues facing older adults in Capital Ward and beyond, and how we can address these issues as a city. This event is being recorded and would be hosted on our Zoom, as you can see, and then live streamed to Facebook as well. And then it'll be uploaded to our YouTube page after. So people will be able to view this at their own leisure later on if they weren't able to attend this evening. I want to acknowledge that we are on the unceded and unsurrendered territory of the Algonquin and Anishinaabe Nation. And tonight I'll really be thinking about elders like Claudette Commanda, an elder who has taught us many things in the Capital Ward office, many lessons, and always encourages us to act and move forward in a good way in our city. And I'm also feeling so thankful for our ward's elders and older adults tonight as well, who've really made this evening possible. And specifically, I want to thank Seniors Watch Old Ottawa South, as well as the groups that they've been partnering with in and around Capital Ward, and Anna Kylitz in particular for helping put this spotlight on seniors issues in our ward together. Thank you. We've got some great panelists here with us tonight. We have Dr. Laura Muldoon, Anne Good, as well as Stephanie Stewart. And I'm going to let panel members introduce themselves in a moment. Stephanie Stewart is joining us this evening from about 7:10 to 7:45 with city staff. So I'll just introduce Stephanie first, but then we'll go to her when she arrives. Stephanie is the program manager for Workplace Equity, Inclusion and Belonging branch within the city. And this branch has the carriage of the city's older adult plan. Dr. Laura Muldoon is a family doctor at Somerset West Community Health Center, and Anne Good is a retired public servant who has advocated over the past 20 years for the care of senior family members and friends while they navigated various health conditions and levels of care. I'm going to give a chance for our panel members to just briefly introduce themselves as well and just tell us a bit more about themselves. Dr. Muldoon, did you want to introduce yourself a bit more?
Sure, if I can figure out all the buttons and the unmuting. Hi there, I'm Laura Muldoon. I'm a family physician and I've worked at Somerset West Community Health Center, which isn't in Capital Ward, but it's pretty close for many years now. And I've also done a fair bit of research about primary care, and that's family doctor type services. And so I think that's the sort of angle I'm going to be speaking from tonight, is about our current, and I don't think I'm overusing the word to say crisis in family medicine primary care at the moment. So thank you very much for the invitation.
Thank you so much for being here, Dr. Muldoon. Anne Good, did you want to introduce yourself as well?
Yes, I'm a retired public servant. I retired from the what is now Global Affairs Canada, and I've worked a lot internationally as well as in Canada, not as a health professional, although I've managed the occasional project as an international project manager. But beyond that, I joined as an amateur with some life experience.
And we're so pleased to have you here. Thank you for agreeing to speak with everyone this evening. So from here, I just wanted to start with some brief opening remarks before we get to the panelists. We really, I think, cannot continue to undervalue the positive impact that older adults have had on our communities, our civic life, our social fabric. We all benefit from these multi-generational communities, especially our kids. And so we can't undervalue these things as we see, growing gap in access to primary care that is increasingly needed in our community as our population ages. We also see a lack of planning when it comes to our elders being able to age in place or age in their community. And we really need to structure our communities in a way that values that ongoing presence of our seniors and not in a way that kind of hives off seniors away from the heart of communities, in facilities that too often put profits over people. Seniors isolation can be combated by planning for our communities to include options for cohabitation, multi-generational or otherwise, like the Abbeyfield houses that Seniors Watch Old Ottawa South has taught me so much about. So it's my hope tonight that we can begin a conversation that starts to seriously grapple with the significant issues we all face when it comes to our older adult population. If we continue to fall short on services for seniors and on planning communities where our elders can flourish, we will all lose. Not simply because all of us are growing older or will grow older, but because multi-generational communities enrich all of our lives. And this affects everything that we think about in the city as well, from transit services to walking, to our snow clearance in the wintertime. So there's a lot to think about here when it comes to older adults and aging in place and that primary care that is so important. So I think with that, I'm going to open up to our presentations from panelists. And our first presentation is from Stephanie. I think actually Stephanie is coming here in about 1 minute. And so I might, if it's okay with everyone, go to Dr. Muldoon to start us off. And then we'll go to Stephanie when she's able to arrive. Dr. Muldoon, does that work for you? Are ready for a presentation?
Sure. I was I was going to respond to what other people said, but hey, what the heck? I'll start.
Thank you so much.
Right off the bat. Okay, so as was said, I am a family doctor, and a family doctor, I don't think needs any introduction to most people on this call. You've probably, I hope, all had a family doctor at some point in your life. What we do in family medicine is deliver something called primary care, and primary care is the level of the healthcare system where you start, right? If you have a problem that's not a dire emergency, who do you go to? You go to your primary care provider, right? To see what's going on. And so that's one of the characteristics of primary care. You got to be able to get there for pretty well everything except emergencies. Secondly, you have to be confident that that person can handle most of your health problems and refer you on if needed. Thirdly, it should be a coordinated system. So your primary care provider should really be in charge of keeping track of everything that's happening to you health-wise. Fourthly, there's a continuity aspect that's super important, as anyone who's had an ongoing provider knows, that you get to know that person, they get to know you, their office staff know you. It makes your care much more efficient because you don't have to tell your story over and over and over again. So those are some of the key features of primary care, and it is a super important part of the healthcare system. We know from international research that systems that are based on good primary care have lower costs, better outcomes, and improved equity compared to other systems. And so it's it should really be the foundation of our entire healthcare system. Who provides primary care in Canada? Well, family doctors, obviously. Primary care nurse practitioners, there's a good contingent of them. And all sorts of other providers who may not provide the full scope of primary care, but really help. So for example, pharmacists, in a way, are primary care providers. You can go there and get advice on certain things, etc. So when we're talking about primary care, although I am a family doctor, I'm not talking just about family practice. I am talking about all these other people as well. So what's the problem right now? Well, I'm sure if we were only in a real room and you turned to the person on your right and turned to the person on your left, you would find that at least one of the three of you probably didn't have a family doctor at the moment. And you would also find that whoever it was having a heck of a time trying to figure out even how to get a family doctor. I have to admit that the question I dread the most from family, friends, patients, etc., is, oh, my family doctor is retiring in 2 months. Do you know anyone good that I could see? And I'd be like, oh dear, I don't even know anyone bad that you could see. I don't know anyone. There is really nobody out there at the moment who is consistently taking new patients. And when family doctors or nurse practitioners do open a practice, it usually fills up almost instantly. Why is that? We have a big problem in terms of the system. Although we are training a lot of medical students every year, and almost 50% of them go into family medicine as a specialty when they graduate and go into a residency program. But then something seems to happen between them starting the residency and actually entering practice. At the same time, and this is really the perfect storm, we've had the pandemic, and we've had a bunch of family doctors of the baby boom ilk who are finding that now might be the time to retire. So we've got a lot of doctors either retiring right now or thinking about retiring. And we've got a lot of new doctors coming in who don't really want to take over their practices. And there are a number of reasons for that. There are, family medicine is actually a fairly stressful job at the moment. It's there isn't a lot of specialist access. If you refer someone, for example, who needs to see an ear, nose, and throat specialist, it may take you a year before that patient can get seen, which means that in the meanwhile, you're still in charge of the patient. You still have to try and figure out what to do. You have to work them through the ups and downs of their situation, unless it becomes an emergency and they go in through the emergency room, which clearly we'd all like to avoid. So as you can see, that takes a lot of effort, on the part of the doctor, on the part of the patient, who is very frustrated, and the system suffers as well because of us using that sort of emergency valve of the emergency room more than we would like. So that's a stressful part of our job now. That's obviously been made much worse by the pandemic, where our wait times for everything are just out of control at the moment. There's a lot of administrative stress as well in our job now that didn't exist. And you can see I'm a legitimate participant in this forum. I've been around the block a few times. Look at the color of my hair. Anyway, it's, if you had asked me 15 years ago, like, how much of your time do you spend on non-direct patient care activities? So filling out forms, making referrals and things like that. I might have said, well, if I see patients for 7 hours, it will take me an hour, maybe 2 at the most, to do all those other tasks. At the moment, it's estimated that the average family doctor in Ontario is spending 25% of their time on administrative tasks. And so there, already you can see an access problem that we had is going to be even worse, because if you're spending 25% of your time on administrative tasks, that's 25% less time that you're spending on actually dealing with patients directly. So it's very stressful. And so I see a question about nurse practitioners, and I will get to that in a minute, because they are also suffering from the same stresses that we are at the moment. So family doctors and nurse practitioners are on an equal footing when it comes to not being able to access specialists, having ridiculous amounts of admin work, etc. The other issue with family doctors in particular is that we train our trainees in a really great model, an interprofessional team model, where they get to work with nurse practitioners, dietitians, chiropodists, mental health professionals, etc., in a team where they know each other, where they can have patients shared back and forth. And then we release them into the real world, where until recently, there was almost no way for them to join such a team. Those teams were very, very limited in terms of how many new doctors could enter them in the real world. There were caps on the number of people, and especially in what's considered to be a well-served area. You could, if you wanted to go to, northern and rural and remote areas, you could probably get onto one of those teams. Whether or not all those jobs would be filled by actual people on that team is another question, but you could possibly do that. But in a city, there was really, unless you took over from somebody who was leaving their practice, there was no way to actually join one of those teams. And so our graduates who were, indoctrinated that this is the way to practice, and I believe that is true. It's not just indoctrination, there's evidence behind it. Would leave their residency and think, well, I can't work this way. I can't be an old-fashioned family doctor working by myself in a solo office, seeing people fee for service. It's just too difficult. I need that other support. I know I can't give the best care this way, etc. So they would try to do other things. And that is one nice thing about family medicine. It is super broad. So if you decide you want to do something other than comprehensive primary care, you can work in an emergency room, you can work in a nursing home, you can work as a hospitalist, you can do all kinds of specialized type clinics. And so people had options. And so when they had options that included something that seemed a bit better what they were, faced with. And of course they took them, and it's only natural. So we've got fewer people coming in to the family medicine world. We've got more people leaving. And so what are we going to do about that? So there are potentially some solutions, and I've seen a few of them flash up across the screen in the chat as I'm talking, although I'm not really good at multitasking, so I didn't read them in detail. But definitely we need to expand our team-based models so that we can have more teams of health professionals who can work together and share the load and provide excellent care. So, more nurse practitioners, more, nurses working in primary care. Nurses, registered nurses and RPNs can do an awful lot. But again, I'm not surprising anyone here when I say, have you heard about the crisis in nursing staffing? It's not like there are a whole pile of people sitting out there waiting to come and work in primary care, even if they had the skills. They're just not around these days. So, but I mean, that is a solution that could sort of move forward down the road. What else can we do? We can maybe think about changing the way we credential international medical graduates. If we really do need more physicians, that's one way we could think about working. We can try and eliminate some of the outrageous amount of administrative tasks that are done. Part of our problem is that we've got this e-health system that isn't a system. And so when you come to my office and I put your information into my electronic health record, that's where it stays unless I deliberately share it with somebody else. In order to refer you somewhere, most of the time, now there are a few exceptions now, thank heavens, this is improving, but most of the time you have to go either into a whole other system and enter all the patient data manually to make the referral, or you use the old-fashioned fax. And I know there's a move afoot to axe the fax, but really until we get a better alternative, axing the fax is just going to make our lives more miserable. So we've got some electronic health issues out there that really, the 25% of our time spent doing admin could easily be reduced if our electronic systems worked better and were more interconnected. And we would provide better, safer care too, because everybody across the system would be looking at the same patient record, and it wouldn't be relying on somebody to remember a list of medications or to remember when they last had a blood test or whatever. So there was a case involved here, and it's one that I think I didn't want to talk about because it upsets me. But the case was of a senior woman who had lost her family doctor, went to a walk-in clinic, then went to emergency, got diagnosed, and then didn't know what to do about following up. And that gives me palpitations because I'm sure it's happening 100 times a day. What can people do when they're in that situation? Well, I am going to be the least satisfying speaker of the night because I won't give you any really good solutions. But number one, get your name on the Healthcare Connect list. Yes, it's long, but if you're not on it, as my dad used to say about the lottery, if you're not in it, you can't win it. So if you're not on that Healthcare Connect list, you won't ever move up it and get yourself a care provider that way. Make sure that you're doing all the preventive stuff that you can do without needing a provider. So you can get your own screening mammograms. You can get your own screening colon cancer tests. You don't need a healthcare provider to do those things for you. You can do those. There are a lot of companies offering virtual visits out there. Some of them are covered by OHIP, some aren't. I really have no idea of the quality, and I can tell you that the continuity is not going to be very good. But that's an option if you're really in trouble. Walk-in clinics, the walk-in clinics that we used to kind of rely on as a little bit of a safety valve, even they are very inaccessible these days. You go to their website and they've got like one doctor working 3 hours virtual only at one location. And it's like, wow, that's not great access either. But I mean, if you're stuck, that's what you'd have to do. Talk to your family and friends. Maybe they know someone who knows a doctor and they could go to bat on your behalf. And before anyone asks, no, don't ask me. I have no space in my practice. Like my own patients can't even get in. Other than that, you can apply to be a patient at a community health center. That's going to be a long wait too. There are, really, I don't have a lot of great suggestions for that poor person who has no family doctor right at the moment, or nurse practitioner. And I really want to emphasize that primary care nurse practitioners are amazing, and I work with a bunch of them. And if you get the chance to have one of them as your provider, take it. It is you will be very well served. So I think that's enough.
Dr. Muldoon, thank you so much for that. That is very insightful. Great discussion. There is lots of questions streaming in, and what I'll ask folks to do is, if you can put them in the Q&A at the bottom, you see Q&A there, that's best, because then I can kind of triage those at the end after the presentations instead of the chat, which is sometimes hard to scroll back up to. So please do put them in the Q&A instead of the chat, if that's okay. And Dr. Muldoon, I may ask you just to respond to the other panelists too, just slightly after they go as well. What you've said is just incredibly informative, but we'll hear from Stephanie and then Anne, and then maybe back to you just as a reaction to what they've said, a quick reaction. So Stephanie Stewart, so glad to have you here with us from the city of Ottawa. And we had introduced you earlier, just briefly, but if you'd like to further introduce yourself, and then I know you've got a PowerPoint that we were going to get up as well. And are you able to share your screen with that?
I think so, yeah. Yeah.
Okay.
So thanks, Councillor Menard. My name is Stephanie Stewart. As the councillor said, I'm the program manager of Workplace Equity, Inclusion and Belonging. It's a branch within the Gender, Race, Equity, Inclusion, Indigenous Relations and Social Development branch of Community and Social Services. And part of one of the plans that my team is responsible for is the older adult plan. So I will try to share my screen here and hope that works. I think I've got it. Can you see that? Oh, no, not yet. There we go. There
we are.
Okay.
That is just coming up now. Perfect.
I'm just not sure if I can share this in slideshow or not. Do you still have it? Do you still see it?
We see it. Yes, looks great.
Okay, great. So yeah, I'll just talk to you. I'll give you an overview of the older adult plan, which, as I said, is operated out of my branch within my service in community and social services. So the vision. Sorry, I'm just going to move some pictures around. There we go. The older adult plan is a strategic plan for the city of Ottawa. Its vision is that Ottawa is an age-friendly and caring community that values the contributions of older adults, offers a broad range of opportunities for active living, and provides supports that are responsive to the diverse needs and choices of older adults. The current plan, current OAP plan, is actually in its third iteration. So it began in 2012, and as you can see from the slide, the last plan goes from 2020 to 2022, so this year. And the actions of the plan align with provisions of city programs and services. So these actions are delivered by an interdepartmental working group, which is comprised of 7 city departments that feed into the progress and the progress of this plan on a quarterly basis. So we ask these departments and the representatives who are responsible for the older adult plan or the actions that are within their departments to report to us on a quarterly basis. And then we provide that report to the Seniors Roundtable, which I'll speak a little bit more about in a moment. But the OAP has an annual budget of $350,000 subject to council approval that's allocated to several of these departments to ensure the various actions within the OAP are met. And these are called initiatives. There's also an additional $150,000 a year currently that's allocated to seniors serving community organizations and agencies via an application process. So these are the four sectors within the 24 actions that the Seniors Roundtable is, sorry, not the Seniors Roundtable, the OAP is responsible for, that we target the initiatives. So the main priority areas are aging with choice, transportation and mobility, well-being and communication. And I'll go into a little bit more detail about those areas of focus in a moment, but just to speak to the Seniors Roundtable. So the OAP is governed by the Seniors Roundtable. It's a group of just over about 20 city residents who are at least 50 years of age or older, who either sit on boards or volunteer with various senior serving agencies within the community. And we also ensure that those that sit on the Seniors Roundtable are comprised of individuals or representative organizations with an equity, diversity, and inclusive background. So this would include the Indigenous community, racialized communities, those living in rural areas, Francophone communities, low-income communities, and others. So this, the Seniors Roundtable members are they like, as I said, they help govern the delivery of the OAP plan. So when I mentioned those progress reports that the interdepartmental working groups provide to us, we then report that to the Seniors Roundtable on a quarterly basis. So there are progress reports that we provide out to that group of community seniors, and they will then provide comments on the status of things and the implementation of those initiatives. So they act as a forum for city staff to get input on emerging issues of concerns to older adults, and other programs and services. So we regularly will get requests in or items that come from other sectors within the city of Ottawa where they're looking for input from or consultation with Ottawa area seniors, and so we will ensure that consultation makes its way to the Seniors Roundtable, either through having a presentation come to one of the meetings or sending the information along to the members of the table. So back to those four fofocus areas. So the transportation and mobility. This slide shows some of the actions associated with that. So accessibility improvements at bus stops and public transit stations, the paratransport online booking. You'll probably recognize the accessible benches, that there are accessible benches throughout the city, safe sharing of pathways between cyclists and pedestrians, review of the city maintenance quality standards. So all of these represent actions that are currently underway as a result of the OAP, the Older Adult Plan. This is en français. The next area is well-being, and these types of actions promote healthy aging behaviors. They're services for caregivers, recreational opportunities, because we know how important that is, with a focus on older adults who are living on low or moderate incomes, access to senior spaces or affordable spaces for priority seniors groups, fitness, health and wellness items, celebrations related to older adults, and volunteer and employment opportunities are just a few of the actions that fall within or fall under well-being. Aging in place actions, which I know is very important to seniors in the community. So these actions focus on the number of affordable rental housing units for seniors, the Ontario Renovates program, and services and care coordinations for seniors who are living in affordable housing. See? And then communications actions include increasing awareness of programs and services for older adults, the older adult activity guide that you'll see and hopefully you have, and the guide for programs and city programs and services for older adults. And the next steps in terms of the seniors roundtable are as you will see, the current plan is in its last year, so it was 2020 to 2022. So we're starting to conduct a review on the progress of the report in the last term of council, as well as prior to that. And when we have a more clearly defined process of how we'll go forward, we'll be sharing that with stakeholders. And here is our contact information for if you'd like to learn more about the older adults plan, or have any comments or questions about it. Please feel free to reach out to us through this contact information.
Thank you so much, Stephanie. That was really, really helpful, and we appreciate you being here so much. I'm going to change it up a bit just because we only have you for a few minutes, if that's okay. And there's just a few questions that have come in, and so while we've got you, it makes sense to go to those questions. Let me just open those up. Okay, so one of the first questions is, hello, are veterans, senior veterans, specifically represented on the roundtable?
Come to think of it, I don't think so. So I think that would be an area that would be very, very welcome at the table. But as I think about the membership, although there may be veterans at the table, there is nobody representing a veterans organization for seniors. So I mean, that would be an area that would be very valuable to have at the table.
Okay, excellent. So Annette, if you wanted to follow up with us after, you can always send us a note and we can connect you directly with Stephanie. So from Maureen, how does the older adult plan influence the official plan recently approved by the city?
So with the official plan, we actually had along with the Council of Aging, and we do have membership at the Seniors Roundtable who are from the Council of Aging, or at least they sit at that table as well. We had quite an extensive engagement process that included the members of the Seniors Roundtable to feed into the official plan. So we had somebody from representing the official plan. We had a couple of people come to present about the plan, and then we had one of our members coordinated the consultation that took place to provide the draft of the official plan, or the areas that were applicable to seniors, out to the Seniors Roundtable members, and then the members fed in and had an opportunity to, after they provided their feedback, to then have some conversations about what they felt was needed, or what they felt was missing, and what they felt that was right on in terms of what they were looking for.
Okay, that's excellent. And right now, the new official plan is not yet approved. It is still with the province. It won't be approved till after the provincial election, and we're not sure what changes they may make to that. But at this time, those ideas from folks working on the older adult plan definitely did inform that version of the official plan. That's great. So I'm sorry, there's a few more questions coming in as we talk. I hope that's okay. One of the questions is, accessibility is a key issue for older adults. Does the older adult plan consider seasonal issues like winter conditions?
Yes, there are actions that are specifically related to winter conditions. So just looking over at my deck, because I do have a number of what was funded. I just didn't want to go into all of that detail, but there are a number of actions that have been funded that are connected to snow clearing around sort of facilities and that kind of thing, with seniors in mind, because so that it's definitely something that is vital, like not only during the winter time, but I know there also in terms of the accessible benches and other things related to mobility and the use of sidewalks and that kind of thing. But yes, there are some actions that are connected to that, or some initiatives that have been funded connected to that.
That's excellent. And I'll just remind everybody that the new winter maintenance quality standards are being updated by the city, and that these are scheduled to be updated It was supposed to be this year, but the city is moving it to 2023. It's for the next term of council to update, and that is where we are very much pushing for bare pavement standards on our sidewalks, for transit stations to be cleared appropriately, for our city infrastructure around salt and sand and our freeze-thaw cycles to be combated by our winter maintenance professionals. So these are things that the standards have to improve upon, and certainly will be part of that discussion in terms of older adults as we approve that in 2023. I encourage people to sign up for that if they're interested in influencing how the city does remove and clear snow in the winter time. A few other questions. Stephanie, what action is being taken to address affordable rental housing for seniors? And how effective has the older adult plan been in increasing new housing starts?
Let me,
It's a big question.
yeah, it is. Let me take that question back with me, because I'm in just looking at the funding actions that I'm looking at. I'm not coming up with something specific to that, but I can certainly find that out and provide that information to either to Councillor Menard's office or
Yes, please do. And so that question, just I'll record, it's Lynn Markel asking, and so we will make sure, Lynn, if you just send us a note, we'll again connect on the answer there. Great question. Okay. Do we know, and I'm not sure, Stephanie, I said there's a lot of interesting questions. Do we know what percentage of Ottawa residents are considered seniors? So that's probably a
I don't off the top of my
stats
head.
cam.
Yeah, I'm thinking about actually the what was it, the report that just came out last week on seniors, talking about the increasing number of seniors that we will have in the, oh, somebody's saying thank you, Anne. About 22% saved by Anne. But we do know, with the recent census, that in the Ottawa area, the percentage of seniors is growing exponentially, and with the retirement of upcoming retirements or ongoing retirements of baby boomers, that number is going to increase. And I believe that from the census that it was stated that the Ottawa area is one of the areas that will have the largest growing population of seniors in Canada.
Excellent. Okay, and that number of 22% came up by Anne. Anne is going to present after Stephanie, and I know we only got about 3-4 minutes left with Stephanie, so we'll just get through a couple more questions and then we'll move on. So this question is, accessibility includes help for partially sighted or partially hearing people. Are there any representatives to ensure that disabled people of all sorts are able to get this information?
So I'm thinking that you're wondering if there are representatives around the seniors roundtable, potentially that are there to provide that, and there are representatives related to services for people with disabilities and seniors with disabilities and related to accessibility. So there is that representation around the table. But if we do, as we move into as we move forward, like we do want to ensure that we are that we have all of the equity deserving groups sitting around the table. So I believe that there are representatives, but certainly that's something that we could look into. I could look into to see whether which organizations those are.
That would be great, and then maybe we can put that out just in terms of for people wanting to access that information. I know the city website has that. Sometimes you have to Google it without, because then it'll come up on the city website. It's hard to navigate without Googling it. Google. So, but that would be very helpful. So there's a question here from Annette, and it says, how do seniors without access to internet book online? Can they call and reach a person instead of having to leave a message when they want to book? Are the languages only English and French, or an ability to request service appointments in many languages. So I think in that, I don't know if you're referring to 311 service, or maybe Stephanie, you know something I don't, but I think
it could be that. There are also a number that it's probably that, but there are a number of programs that are initiatives that are funded by the Seniors Roundtable, like the library, like services at the library, and where you can book online, and different programs where you can book online, but there are also mechanisms for booking by phone. And in general, I mean, well, actually, if I speak specifically about the library programs, they do make every attempt to connect somebody who is speaking English or French or another language with the appropriate person, so that they're able to able to be understood in their native tongue. That is something that we're working to, that these types of programs are working to improve, and in our allocation process, we're increasingly looking for those types of considerations in the programs that we're funding.
Fantastic. And then there is a question about availability of services in French needs, and I believe that is fully accessible and available.
Yeah, and so not all of the initiatives that are funded by the OAP are available in or accessible in both French and English. Again, it is another element when we're doing funding allocation, that we're encouraging the departments to ensure that they have thought about and that they have considerations for. There's definitely a percentage of the initiatives that are either francophone or bilingual, and we do have very strong francophone representation at the Seniors Roundtable, and they are also Seniors Roundtable representatives, as well as some city staff who sit on that allocation committee. So and I think that's important to know, that when the proposals come in for funding allocation, there is a variety of people at the table, but it's at the allocation table, but it's mostly represented by community members, and so that allows us to ensure that we're aligning the types of initiatives that we're funding with the current needs of the communities.
Thank you so much, Stephanie. This will be the last question, because I know you have to go now. And thank you for being here. That is a huge help. The last one we'll go to is just about the reports. So are the reports accessible? Did you say they're quarterly reports? Someone is asking if they're quarterly reports, and how might they be accessed?
Yeah, so the reports that I'm speaking of are reports that are given from that are collected by the city staff person who is responsible for the older adult plan from the departments, and those are then given to the Seniors Roundtable. Now, as far as are they public, I don't know. I don't have that answer. So I'll need to check on that. I'm not sure what's on I think the things that are on the website are more broad. But I need to check on that.
Thank you so much for being here and answering questions. I know we kind of changed the format up a bit, but only had you for a little bit, and so appreciated. Thank you for your expertise and all you do for the city. It really is appreciated.
Oh, you're welcome.
We'll let you have a nice night and talk to you soon. Thank you, Stephanie.
Bye.
All right, so I think that was great. There's other questions in there that we're going to get to after Anne's presentation, and so Anne Good is up next. I'm very excited to hear from Anne. Anne, please maybe say a little bit more about yourself, and then go ahead.
Oh, I think I've said enough in the sense that I've done a lot of project management over my lifetime, and I find that I needed those skills to track down resources, figure out how we could work with people. I have a presentation. Maybe I can just share the screen now. I ask if Miles will let me do that and see if I can do it well. Okay.
Absolutely.
Share. Are you able to see it?
We are seeing that now. I'm not sure if
Okay.
we go to presentation mode.
The problem is now I can't see the. I have to move over your thing so I can get into slideshow. Okay. Can you?
And then if you click on from beginning,
Can you see it now?
it's the same as it was before.
Be able to go from the beginning.
Yeah, that should work if you click from beginning and then expanded it. We can see it though, Anne. We can see the first slide. It's just a bit smaller. Well, we can see the first slide. It's just a bit smaller, but it worked. We can see it.
Yeah,
it's okay.
it will be harder to see. Okay, I will try one more time. No, this will not do it for you. Okay, well, this is okay. Can you see now?
Yes, we can see the first slide in the window.
Then we're good. Okay. So as I say, I am not a health specialist. I'm just looking at what it looks like from where I stand. And the question is healthcare a Canadian priority? I'm aware of a recent study by the Organization for Economic Cooperation and Development that found Canada invested the least in health amongst 13 countries studied. This is not good news. And Ontario spent the least per province in health services in 2020 of all provinces and territories. So we've got a lot of work to do. Some people have said, well, Denmark has a great system, but do remember it has got a system of sort of this naturally occurring retirement communities where people work in a more multi-generational system and the health services are provided, but it is a federally managed health system and we have the provinces to deal with. So whatever we come up with in the next while is going to have to be adapted to a Canadian model. So here's my spoiler alert. Prepare yourself now. You must plan for several stages of care as you age and as your circumstances change. They could be physical, they could be mental health changes, your family situation could change, your finances could. And you hope very much to stay at home, but it is possible that maybe with certain conditions you won't be able to. So I'm just flagging, consider you may need to move along the continuum of care more than you originally expected. So my experience was the last 20 years dealing with what was first the community care access centers, then became the local health initiative network, is now a big mouthful about home and community care support services. I see a raised hand. Is there anything that I need to know?
Well, and I think the slides are, I don't know if you're still on the first slide or if you've gone into the second slide, but the slides don't seem to be working.
Okay.
So, well, we can see the main first slide. It's just that it's not changed. If you scrolled down one, we could see the next slide, but you'd have to do that every time. So,
can you see the slides now?
So if you, excuse me, folks, can you try doing a Shift F5, Anne? That should trigger the presentation. And if not, I'm happy to try taking remote control for a second and see if I can.
Why don't you do that? I'm not an expert here either.
Okay, I'm going to request it and you'd have to approve it. There should be a.
Okay. All right, we can resume the slideshow.
Okay. Let's see here. Is that? It's almost as if you need to you're sharing like the wrong screen sort of thing. So I think what Councillor Menard suggested before is to stop the slideshow and just to scroll through the deck on the application window itself. I think that's probably going to be the best bet.
The application window. Okay, I'll just change the slides and I'll speak to them anyway. I've had 8 seniors, as I say. Issues included dementia, Parkinson's, sight immobility limitations, and stroke, and cancer. And increasingly, we're caring for more contemporary seniors who are not getting the care they need, plus other generations. So what do you need to age in place? Basically, gerontologists are suggesting, you need social connection, purpose in life, good physical and mental health, healthy physical environment, a safe, comfortable home, good financial situation. Okay, suitable local
I was
resources.
just going to say, and let's just pause for 1 second, okay? Because I think people are very interested in seeing your slides. So I'm just going to come back online here, Miles. And so I think if you can email, what we'll do is if you can just email your PowerPoint to Miles or Thaisa, and then we'll get it up from them, because I know the folks here and the attendees would love to see those slides, because you've got a lot to say in it. And so I just want to make sure we can get those up, and then we can run them through. And so you can look at the screen and just say next, and we'll put it next for you. But if you can just email, if you haven't already, to Thaisa and to Miles, one of the two, just email that PowerPoint, and then we'll get there. I was wondering, Dr. Muldoon, while Anne is doing that, if you had any just quick comments from Stephanie Stewart's presentation, or the older adult plan that you heard about in that presentation, if there's any comment you wanted to make on that.
Yeah, well, I think it's super important, like clearly in terms of being a foundation for health and needing fewer healthcare services, it's really important to have the kind of programs and the kind of accessibility. You know, it's really interesting. I remember being at a meeting in the 90s about seniors' health when I was just a young whippersnapper. And my big thing that I'd been noticing after I moved to Ottawa was how terrible the sidewalks were. And so I remember saying at this meeting, you know, our biggest problem is winter. And they all looked at me like I was nuts. But I really think that is an important thing to combat isolation and fear of going out and injuries and all kinds of things that, you know, that Stephanie was talking about. So,
well, I'll tell you an anecdote, because I think you're bang on. We started city council. I was elected at the end of 2018, and that winter, the 2018-2019 winter, I grew up in Ottawa, but it was one of the worst winters we have ever experienced by far. It might have been the worst. We had the ice storm and everything previously, but that was one of the worst winters ever. And the calls we were getting, we had 4 staff members in the office. We were all on the phone at one point just talking about the snow clearing. And what was happening was seniors were calling us, not able to get out and around at all. Some of them trapped in their homes needing assistance. And that's when, from that day forward, we held 2 different snow forums and put out 2 different reports on this, because of how bad it had got. And our snow standards were not up to par. We might have cleared the road, but the sidewalks weren't cleared at all. So the roads were getting cleared first, and you're lucky if you could get out to the road on some of those days, and they weren't clearing the sidewalks. So this is a big thing about the standards, the slip and falls. And I mean, it's not just, obviously there's health and safety here, but there's liability for the city. It makes sense for us to clear these properly and have a bare pavement standard like we do for the roads. So this is such an issue for seniors. I know Anna Kylitz has done a lot of work on this with the snow moles in Ottawa, and they go out and they will research. And big plug for the snow moles here. If you're interested, the snow moles do incredible work of audits on our streets and say, look to the city, here's the areas where you're not meeting it. Anna, I'm wondering if you can unmute yourself. Maybe you wanted to mention something about this piece on the snow clearing.
Yes, thank you, Sean. I have to explain, though, that the kudos go to Diane Breton and let me see here, has asked to start the video. To Diane Breton, the Council on Aging. I'm not visible. The Council on Aging is coordinating it all, and they produce very impressive reports. And I noticed that the Transportation Committee does pay attention to what comes out in those reports. I noticed that Diane was here tonight too, so I know that we have been very busy, very active in the past, and we have had very fun snowball launches and get together, but now with COVID that wasn't possible. But I think we still produced quite a few reports, but thank you for paying attention to that. And it still unfortunately remains a problem, the walkability. And I think some areas just might need heated sidewalks one way or another. You know, they have it in some places, because whatever they have, it's still not good because of the fluctuations between thaw and freeze in our city.
Absolutely. And a huge thank you to Diane Breton, who's done so much work on that. age-friendly communities, and producing those takes a lot of work. And this is one of the tools that helps. I remember walking with you folks out of Old Ottawa South and doing these audits because of how important it is in terms of the city taking that information. I know staff take it seriously, but I know how involved everyone will be in 2023 when the new winter maintenance quality standards get updated. That's when we're really going to have to push them at the Transportation Committee to get this right. And that's our big opportunity. They haven't been updated in 20 years since amalgamation. So our big opportunity is coming up, and we can't miss that one for another 20 years of the same thing. So I think Thaisa has the presentation, Anne's presentation, and you'll just have to tell us when to switch the slides, okay? It just say next slide, and Thaisa will do it for you, switch the slide. So
Let's
I
go
think
to
it's
the third slide. I was just talking about the conditions that are optimal for us, and that is fourth slide, sorry. That social connections, good physical and mental health, finances, able to pay for services, able to find services where we need them if we can't get them from our regular health services, and some resilience. So for the next slide, I was looking at dealing with changes as you age. This is when I say a sudden change, and you got a change in lifestyle. So an accident, a heart attack, a stroke, a fall. If you're hospitalized, there'll be an assessment at the hospital as to whether you can come home or not. And all of a sudden, you've got to figure out, okay, would I be able to get up the stairs to bed? Is it going to be difficult for me to bathe myself or dress myself? Is there someone at home who can keep an eye on me? So if you are not deemed well enough to go home, you'll sit in hospital until some suggestions are there for you. But supposing you do get home, that you will be assessed by the home and community care support services. And they'll look at what your home looks like in your condition, temporary, or whether you're going to have a longer term issue now because of what has happened to you. So that will then put you onto the potential for subsidized home services. There are other cases where it's gradual, where you're noticing memory issues, worsening cognitive or other medical conditions like neurological issues. So that's when, if you're lucky to have a family doctor, that's the person who refers you to home and community services. For the same kind of assessment, they come straight into your home and they have a look. Do you have the toilet that's the right size? Do you need supports? Do you need a bed rail, handrail? And then they may also identify programs for you. If there's more than one person in the home and that person is a caregiver, they may find opportunities for a day away program for the person who needs extra support. So that's your beginning. Next slide, please. Now, if you are a caregiver, we should note that women are usually 2/3 of caregivers. And this is from StatsCan. They say most report coping well, but it's still physically and mentally stressful. So if you're providing care to a loved one at home, caregivers will need support too. And I think we need to build this into whatever solutions we have. It will be very important because levels of cortisol will rise, and the person who's the caregiver may also be more prone to heart attack and other health issues. Next slide. If you're single, please plan for a future when you can't do everything yourself, and do learn to ask for help. It's tough if you're independent, but there is a limit. Have your paperwork up to date. Everybody should have a will, but also remember, whether you have family or not, someone should be there to advocate for your health if you're not in a condition to do so yourself. So do have a power of attorney for health and property, and make sure you have one or two alternates for health. I've been able to do that for my friends' parents, and it makes a difference. Keep up with your friendships as much as you can. And this is asking your family doctor, if you can, for in-home assessment when you suddenly think, maybe I do need to keep an eye on parts of my home and how I get around it so that I can plan for the future. Pay for additional services. If you get an assessment and you have some subsidized care, it's unlikely to be enough when the time comes. Consider technology, Fitbits and alarms and whatever. They may feel a bit invasive, but it would be really nice to know someone can come running when you fall. And stay computer literate. Ideally, by the time you're 80, you should know how to work with a computer, because otherwise those skills are hard to learn later on. Next slide. Now, I don't need to go into everybody about maintaining a healthy lifestyle and exercising, but you can see these are guidelines for seniors. Up to 300 minutes a week of moderate exercise. That's walking, swimming, biking, gardening, and lifestyle. If we can delay the loss of independence by 10 to 12 years, we should be healthy while we're at it, and lower the risk of dementia as well. Okay, I'm going to show you, next slide, the supply side. We've heard from Dr. Muldoon, we know there aren't enough healthcare workers to meet the needs for our aging population, and especially not to keep seniors in their homes, which is unfortunate because it costs about a third as much to support a senior to stay at home as it would be to put them in hospital or long-term care. So the lowest paid health workers, those are the ones who come to you from the subsidized care. It could be, you have Abbeyfield, there's Bayshore, Care for. These are workers who the company wins contract with the ministry, and that means that they have to keep within a budget. They're the lowest paid. There's a highest demand on their time. They have to have a car to go from one place to the other, and few benefits, very rarely with full health benefits, of course, which is the irony. And there's a lot of turnover. So also organizations that provide health professionals to your home also have a for-profit model for their own services. So you might be able to get only 4 hours care of someone to come and bathe your loved one who needs that help. And then you say, I need more help over the weekends, and then you have to pay at the market price. Instead of $20 subsidized, you might be paying 30 some. Next slide. Now this is wonderful if you have a family doctor to help you out to do this. So maybe Dr. Muldoon will have some ideas. A disability tax credit is actually a medical credit. If you have a condition that makes it difficult for you to live independently without some help, but you could remain in your home, this is a lovely idea, because any of those subsidized services, the part that you already pay for that home care, are part of your tax credit. If you contract directly to someone like a personal support worker for in-home care, that person has to give you a receipt, but you include that in your income tax, you get a tax break. Paratranspo, even adaptive clothing. You know, clothing with Velcro rather than buttons for people with arthritic hands. Now, the doctor can complete the form and submit it online to CRA. Most times they're accepted. There may be other questions, and probably the first year after you do put in a claim under the tax credit, you may be audited, but it's worth it. If it is necessary to move to more care, retirement residence, assisted living, or long-term care, the credit really, really offsets a lot of those costs, and it makes it more affordable. Next slide. Equip your home and your car. I'm just showing you a few of the tools that we have put in our own home as we've renovated over time. ADA is the American Disabilities Act, but you'll find a number of suppliers, plumbers, and renovation stores will have these kinds. You can see, for example, a teak seat in the shower. This is nicely braced behind the ceramic, so when you do your renovations, think of it now. You can see hand bar as you get into the shower, another hand bar in the middle photograph. You can hold on while showering. The lower one is if you're having a bath, and you can use it to lift out. Raised toilet seats are really important, and in-home assessments will probably tell you whether your person who needs a bit extra care is able to get up and down from toilet seats. It's the height, it's not just grab bars, I can assure you. Handrails, perhaps, if you have a couple of steps within the house, fewer steps within the house, or to get into your home or on your deck. Maybe wider doorways if the time comes that you might need a walker or a wheelchair. Non-slip surfaces, you might start removing carpets in time. Volume enhancing telephones are really important. Some people can hear on these telephones, but they can't hear the phone ring, so there are flashing light options as well. We use a car cane. You may not even know that on the passenger side of your car, there's a little hook, and this cane, which is about 20 bucks at Canadian Tire, will hook into the door frame, so the left hand can hang on and the right hand can hang on to the car door in order to get into a car. So we transport cancer patients that way. Next slide. So what other resources are available? Well, there are businesses, certified aging in place specialists who provide support and health specialists directly to you as well. There are companies, I'm just mentioning one, but there are others. This is a nurse managed company that will assess your needs and build and adapt to your requirements. And there are government grants for some of these. They'll be in my resource slide. There are online exercise and fitness trainers. I have a trainer by Zoom, but it's always good to get a certified person to assess you in person to see what you're ready for and how you maintain. You need to look at your balance, mobility, and items like learning how to safely pick up items and not fall. And another hint, the Red Cross often has donated walkers once people no longer need them. Wheelchairs are expensive. So maybe you can test these things out by borrowing from the Red Cross before you commit to something that's tailored to your needs. Next slide, and we're nearly done. Dealing with a gap in resources, we're going to have to make our voices heard. We've heard from Dr. Muldoon. Health professionals are tired. They've been hollowed out through COVID. Some people are leaving the profession, and we have to be politically active and make all the candidates in the next election know how important this is. And I'm saying there are a few solutions for ourselves. We have to get creative. If you can't afford market prices for seniors, consider looking for someone directly yourself. I know where the PSWs hide out now. And often nurses and PSWs have only part-time options and they want more steady employment. So if you pay them a good wage and if you've got a tax credit that offsets it, it's really worth your time and your money. So for the next slide, I'll just say regrets. I won't sing this, but if I had, I would advocate even more, certainly for support to mobility, more physiotherapy. If you don't get it subsidized, pay for it directly. Use your savings if you have to. Make yourself exercise if you're still able to keep up an exercise routine. You can improve your flexibility according to University of Ottawa specialists who work with seniors. Exercise, I think you can maximize your ability within a month. Have a healthy diet. Stay computer literate, keep socially and intellectually engaged, and network and be politically active. Will need to be. Last slide, and these are just resources online, and you will now have my slides, so I'm happy to share them. McMaster University has an awesome portal. The federal retirees and their CARP are both excellent organizations, and they work with Council on Aging and other organizations. I'm not a member of the Council on Aging, but these are great organizations for us. I put in the Ontario Power of Attorney Kit if you don't know how to access that easily. Ontario Program for Assisted Devices, there are some grants. Also, EnviroCenter can help you make your home more energy efficient, which will save money for you. Project Big Life, you can take the quiz. It looks at indicators of your life expectancy according to your lifestyle, your health issues, where you live. And this new idea of naturally occurring retirement communities, let's keep an eye on this. Maybe we can evolve more intergenerational support. Pallium Canada and Dying with Dignity provide you with resources closer to end-of-life care. Pallium's very good in terms of training health professionals and providing each person with the opportunity to look at their finances and their health conditions and their priorities. So with that, I'm going to stop and welcome any questions. Thanks for doing the slideshow for me.
Wow, and that was tremendous. Oh my goodness, what a wealth of information. Thank you so much for that. And just being here for that information and for people. I did have a question about the slide deck itself. And I said, you can email us at capitalward@ottawa.ca, but I need to get Anne's permission first if they're able to access this. Are you okay if we do send, if somebody emails us, if we send the slide deck that you've sent?
Yes, I don't mind at all. I even had a couple of spare slides because I'm really well aware that we have a great expertise in Ottawa. And I also listed some of the doctors that are doing research into elder care, stroke, exercise, fitness. So I'm also happy to share that slide separately.
Oh my goodness, thank you so much. So we'll, yeah, folks want to email us at capitalward@ottawa.ca, then we can always send you the slides here. Just an incredible wealth of information. So there's a lot of other questions here. And so I'll go through a few of them. John says the biggest problem many seniors face is loneliness.
Yes.
What might be some options for seniors who are facing loneliness? Do you have some advice?
Well, certainly I found that with my mother who had hearing issues, having access to a computer, being able to Zoom or send photos or connect with family that was near and far was really helpful. And I do think that we should be using young people a lot more. If you get your local the volunteer credits that students get in high school, perhaps if they were able to come and help a senior walk around the block or something to maintain their mobility, because then that would be a communication and interacting. I'd like to see post-COVID that people get to go back to programs like Good Companions, where I know one of my seniors used to go and play bridge, and that was a good opportunity for learning what was going on in the community, in addition to meeting with each other and sharing a meal. I think that we can do a lot with not only, say, hiring an extra person to come to your home. I had a PSW go and play board games with my mother. Small things, but they were really, really useful because you would look forward to that day or take her out for a walk. It's probably the hardest thing for people to stay home. It may be the push that they have to move to a retirement home. And I can say those are very mixed blessings. Theoretically, you do get nursing care, but one of my seniors did not get enough care for skin conditions. And by the time I was called in to advocate for him, it was an oozing wound. And the director of care told me that she was looking for another job because there weren't enough resources within the building because it was a for-profit retirement residence. So yes, we can find more activities, more intergenerational activities that we involve our seniors in, and that they can stay at home, all the better, I think.
Thank you for that. That is very informative. And I know, John, you know, in terms of the city side itself, I think there's more that needs to be done here. This is one of those ones where I would, connect with Ms. Stewart, because this is one of the key things that the city can do. It's a fairly easy thing, I think, to try to have intergenerational connection in particular. That kind of pairing, particularly in the pandemic, we had a list of volunteers if people needed anything. And so many people had signed up to volunteer and were ready to help. But I think it was hard for people to reach out at that time to ask for the help. But one thing in Anne's presentation is you need to ask for help. You need to advocate for yourself in a lot of those ways. And so, I just know in Capital War, we've got this big list of volunteers that I know would be willing to help with anything in that case. But I think it's more of a social thing because loneliness and isolation within Ottawa, particularly during the pandemic, is a serious issue, and it only gets worse in winter as well. Seasonal affective disorder, but then just being shut in with the conditions often. So this is a real issue, and glad you raised that one. Thank you for raising that question. I'm going to go, and also Dr. Muldoon, I was wondering if you could come back on the screen as well, because we'll do questions for both of yourself and Laura as I go through here. Dr. Muldoon, I'm wondering what you thought of Anne's presentation.
Oh, I thought it was super. I mean, clearly she's got lots of experience and has definitely pointed out some of the pros and cons of our home care system. I mean, it's not the greatest, but it does do a lot for people when they really need help. And, especially for people who do not have savings, who are living on a fixed income, old age security and things like that. It's all they've got. And so we have to work within that system as much as, especially at the community health center, because we tend to have patients who do not have additional funds or insurance or anything like that. So we have to work with those systems. And I think, Anne, you mentioned some of the other community organizations that are really superb in terms of helping seniors to avoid isolation and such. And that's places like Good Companions, Ottawa West Community Support, and places like that that are, you know, that really are out there in the community providing some of the services. You know, I know when my mom was aging, she accessed some of the services through Southeast Ottawa Community Health Center, which included like the grocery bus, where she could, you know, get the bus to the grocery store once a week. And that was super important to her. And she loved it. And she met all kinds of people on the bus, and they gave her great tips about, you know, oh, I have this handyman for my yard and things like that, which, you know, it was more than just the bus. It was it was all that sort of interaction around the bus, and that really helped her actually to stay at home longer. So I kind of digressed there, but yes, I completely agree with many of the things that Anne said.
Excellent. And someone asked, is this information all available in a booklet that seniors can access? And I mean, just from tonight, no, the presentations and will have to suffice. But is there anything that either of you'd recommend in terms of reading a booklet or something like that that might be helpful? Kind of hard to find that information, I guess.
You know, you can find something. Even this ward is served by the Champlain, which I think the website still says it's the LIN rather than the Home and Community Care Services. And they do list what is available. You know, these are partner organizations, but they really don't show you the how-to. And it's only when an emergency shows up that you start having to inform yourself very quickly. I don't know, I can't think of anything particular, but these organizations that outreach, they're the ones who say, well, have you tried this? Or, you know, have you gone there? But it's hard for people to ask for help sometimes and not know that. So the idea of the bus, or the idea of, you know, a teenager coming in and saying, okay, we're here for a walk today, how are you doing? Just that those contacts make a huge difference.
Fantastic. There is a question here around our city programs addressing mental health and well-being. So there is the mental health and well-being plan. It's a brand new plan that's just been released and has been receiving feedback for some time. If you look up, Google it, mental health and well-being plan, City of Ottawa, it will come up. And so this is a wide variety of topics that exists in here, and certainly seniors factor into that plan, older adults. And so if you want to take a look at that, please do. Maureen says, when you see developers' applications, it doesn't seem to me that priority is given to the older adults in community development. You know, great comments there. I think this is something we need to change through site plan and through our negotiations. I will mention one example, because Seniors Watch Old Ottawa South does a great job of this, is when new developments are coming up in Old Ottawa South, to go directly to the developer and say, look, what are you doing for you know, for housing models for older adults? Is there some common space? Is there intergenerational co-housing units? These are things that in a new development at Bank and Riverside, we're putting into a memorandum of understanding, one of the first memorandums of understanding in the city, that would compel that developer to work with Seniors Watch Old Ottawa South on these types of housing models, making sure that units are accessible, you know, and large enough, and that there's a certain percentage that are going to be serving a population that wants to age within the community. So this is a great question, and something that certainly we need to continue to work on here. I'll just look for other questions here. Okay, is there any effort to support co-housing, which has been found to be a powerful intermediate between aging at home and going into a retirement home? I wonder, Anne, or...
Yes, Enviro Center had announced that they have a new member which is Ottawa co-housing. I did have it in my list of resources, but then the list was getting too long. So I can add that and send it out, the Ottawa co-housing. They also seem to be a group that can help people look at the implications of building and having co-housing of multiple residents, and what the legal implications are, and structures, that kind of guidance. So yes, it is out there, seems fairly new. I don't know them yet, but I did think it would be worth looking into. So I'll send that.
Very good. And this is something that we really want to see more and more. There is development happening over in Old Ottawa East, and we are working right now with the school board, Ottawa Community Housing, on seniors co-housing, not co-living, but co-housing, intermixed with a school that will be in that building, with a community center that will be in that building, and units intermixed within a broader development. So this is the type of future that we need to be thinking about here in Capital Ward as our population continues to age. And people want to stay within our ward, where they've either lived for many, many years or might have grown up here. So this is the type of thing we need to continue to work on. I'm proud of what we've done in Old Ottawa East, but that's just a small example. 30 units. We need a lot more than that in the future. Right. Senior centers like Good Companions and Abbotsford at the Glebe Center are open with programming, fitness, clubs, and fun. So excited to be meeting again. And so I do wonder if there's anything else you wanted to mention about senior center or that type of connection within not just the ward but in general. Any advice at all on that front? I think this is more of a comment from Pat, but we'll open it up to see if there's comments from Laura or Anne.
Well, I think those centers are invaluable, and even though there is no booklet about where to go for help, if you can find one of those places, they often have at their fingertips a lot of information about the various resources, as well as offering the opportunity to do some volunteer work, to socialize, because like doing volunteer work is another thing that we often forget about, but seniors can do lots of stuff and across generations, and it is a really life-giving kind of thing to do. I know and I know, I'm sorry, it's not in the ward, but my office is directly above the Parkdale Food Center, and we've got volunteers of every age streaming in there we did before the pandemic, but streaming in there all the time to help out with community programming, and seniors have a lot of experience and a lot of talent, and can really share that with the community, and that's a wonderful thing that also happens in those senior centers.
Thank you. Anne?
May I just suggest, it would be really nice if senior centers help to train people. I'm thinking of helping to walk with a 90-year-old to make sure that she doesn't stumble, or someone with a walker, not leaving them alone, noticing that if you leave them sitting for 5 seconds and they decide they're smart enough to get up and go to the washroom, to put the walker in a particular position with the brakes on, and just sort of anticipate things that might be difficult, especially with masks right now. People with hearing issues have such a difficult problem hearing and understanding. So if the centers could help train people to learn to work with seniors a little bit more, taking them to the washroom and finding that it's not a good height of the toilet, and all those things that happen, and kind of you can anticipate.
That's excellent advice. Thank you. And there's a question here about why not more clinics? I used to have access to Carleton University Health Clinic. I had a regular family doctor, but if she wasn't available and I needed something, I could get access to other doctors. So I guess it's a question just in general about clinics in the neighborhood. I'm not sure. Maybe Dr.
That's a good question, and I'm not sure that I have the answer to it. I think it's sort of, the answer lies in what I was talking about before, which is our crisis that we've got right now, and the old style clinics. Well, let's just go back even before that. back 30 years ago, pretty well 99 or 8% of doctors in Ontario, family doctors, were paid what's called fee for service, meaning you have to have the patient come through the door and you talk with them or assess them, and then they leave, and you can charge a certain amount of money for that visit depending on how long it lasted and what you did. It was thought, it still is thought, that that is a system that can work in some cases, but it's much better for acute needs, you know, sprained ankle, sore ear, et cetera, et cetera. It works okay for that. But in terms of managing people's health as a whole, in what we like to call now the patient-centered medical home model, where we are looking after all of your health, it doesn't always work so well, because if you are that 90-year-old who needs help mobilizing and you do need to come into the clinic, you're going to be there longer than 5 minutes, and you'll probably be there longer than 10 minutes or even half an hour, because you probably have a number of issues that need to be addressed. And as I said earlier, your primary care is supposed to be comprehensive, so your family doctor is actually supposed to be assessing all those things. The incentive under fee for service was for the doctor to say one problem per visit, come back next week, because every time you came in the door, he got paid, or he or she got paid again. So there was a big move afoot to change the way doctors are paid, and it sort of happened across the country, more in Ontario than anywhere else, actually, in this country. And so now many doctors, but not all, we still have a fair bit of fee for service out there, especially in the city of Ottawa, but many doctors are now paid on what's called blended capitation, not decapitation, capitation. So it means payment per head, if you want to go back to the Latin. And so when you sign on with that doctor is paid a certain amount every month just to have you on their roster, whether or not you actually come in for service. So as you can see, it might mean that they don't feel the need to, you know, run people through every 5 minutes, because that's not making any extra money. So under that system, this is where so that was a model called the Family Health Network model, and then we got the Family Health Organization model on top of it, which was very similar. And those are the parts of the payment systems that where entry into them has been restricted. Now we've got a new physician services agreement that the provincial government has just signed with the Ontario Medical Association, which has lifted some of the restrictions on physicians going into that model. And as I said, our young graduates do not want to work fee for service. They do not want to work solo practice. They probably don't want to work in a clinic either that's run on a fee for service basis. So we're hoping that we can get more expansion of that particular model, and our younger graduates will feel more inclined to set up practices like that again, because you're right, that works great. I mean, in my center, we have a walk-in clinic, which is open to people who live in our catchment area, provided they don't have another provider somewhere. And our nurse practitioners run that walk-in clinic, and they work in collaboration with us. And so there are many ways to do this, and many practices have excellent ways of doing this. It's just that it's not, 100% across the board widespread, and you have to get into the practice first to benefit from it.
Oh, thank you for that. Very, very comprehensive answer. And there's so many questions coming in too, and hopefully we'll get through some of these. Catherine says, well, I would like to downsize as an active senior. It's a challenge to store sporting equipment such as a canoe or kayak or bicycle or skis, snowshoes, camping gear. So it sounds like, I wonder if there's some innovative models out there where these can be kind of kept. I know co-housing might work in that way, or other kind of rental models. But any advice, Anne, for Catherine, if somebody looking to downsize, but they have a lot of things, they have a lot of stuff from life.
Sorry, I was on mute. Congratulations on being physically fit. I don't know about any models, but it sure would be a nice business model, wouldn't it? That I store your off-season equipment for you for a modest fee. And then, yes, you wouldn't have to have such a large place to keep things in. But no ideas other than that, sorry.
Fair enough. I know there's been some great trails and outlets that kind of just, lend those out to people. It's kind of a separate thing, but the Rideau Winter Trail that has been opened up right beside the Rideau River. Great for exercise in the urban area. And I know that there's some organizations that have been doing some kind of either rental or for free, lending out equipment as needed. The tool library is a similar model. I will just go through. Are we actively seeking more geriatricians for accessing seniors and helping the whole person over the many years of aging? Seems like the 65 to 95 years, we can live 30 plus years as seniors of age, deserves their own specialists who are readily accessible. So I'm not sure if you caught that. I kind of read that a bit strangely, but I don't know if anyone wanted to comment on that.
Well, I would start by saying that we have actually a pretty good and robust geriatric assessment program in Ottawa compared to many other places. So we're very, very lucky here that we have the regional geriatric program, and they work in a specialized model. So again, it's a referral from your family doctor or from the emergency room to their services. But they have pretty comprehensive stuff available, and there are waits, but they're not as bad as they are in many other specialties. But yes, I agree, with Anne referred to the gray explosion that's coming or is happening right now. And yeah, we'll definitely need more geriatric specialists. And incidentally, that's one of the things that our family medicine graduates are going into. They do their 2-year family medicine residency, and then they do a 3rd year in a program called Care of the Elderly. So while we're sad they're not going into comprehensive family practice, we acknowledge the value in that. So
thank you. Anne?
Yes, it's. I think people will be interested to know that Dr. Glenn Kenny of the University of Ottawa does a lot of work with seniors. He's on my list of resources that I'll send out the additional slide. And he said that they do assessment of seniors, of people who are interested. And I've been involved in kinesiology studies where they've had control groups and using assessing skills that they can help rehabilitate stroke patients. So there's a great deal of interest in having seniors work with them. But I have to confess that Dr. Kelly said that what he knows scares him, because he knows that we've got this aging visit and we do need to stay fit. And he does have a number of experiments there. But when you see that there are resource people, there's an aging in place group at the National Research Council that's looking at technologies. There are both Carleton and Ottawa, you have stroke and brain fitness people. We should be amongst the first to know about them because they are here, and we should draw on them when we start looking at solutions. These should be some of our experts that we can pull in.
Okay, excellent information. Thank you, Laura and Anne. And yes, I pronounced that incorrectly. Geriatricians is the word I was looking for there when I read out that question. Thank you. There's a question here for me. It looks like, hi, Sean, Cecily. Some of us older adults have given up driving. There are many destinations we'd like to get to off of Bank Street corridor. What is the status of your campaign plan to run shuttles down Bank Street? Well, great question. This is a big one for us because we've been talking to the city a lot about this, and Bank Street is a clogged corridor. They actually just raised transportation committee coming up in about a week and a half. There's a potential pilot project there for the glebe that would look at these types of shuttles, more active transportation and walking options rather than the current model that we have in that corridor now, which is a lot of car parking. And you need some of that as well for accessibility purposes, but not a lot of other potential options like taking transit. So all along Bank Street, we would really like to see, free or very low cost transit in a clogged corridor. When you buy a ticket for anything at Lansdowne, you get free transit as part of your ticket. And we'd like to see that a regular shuttle option up and down Bank, given the services that are accessible there. It would help businesses, it would help people. For seniors, it is free to ride OC Transco on Wednesdays and Sundays. We were happy to see the Sunday pledge come into play this term of council for free transit for seniors on those days as well. We'd like to see that extended though. This transit service has not been very good in the city, unfortunately, and the LRT has not worked out the way that it should have. It's been a big expenditure, and that's why you see the inquiry happening now. But in terms of actual transportation, We're still pushing this city to try out some of these pilots and to add the proper bus service and lower the cost of bus service for people in those clogged corridors. So we think that's sound, and we'll continue on that end. There's another question here. What can the citizens be requesting or lobbying for or otherwise from the city, and what can the city affect to make these things better or easier? It's a great question. I'll just jump in, and then if Anne or Laura have more to add, but one of the things I was just mentioning is around the winter maintenance quality standards. That really is a big opportunity. I'd say it's one of the biggest opportunities in terms of improving age-friendly communities. And if you are able to, the winter maintenance quality standards in 2023 are being updated, and that will go to committee. It would be extremely powerful, I think, to have older adults show up at that committee and say, we want properly cleared sidewalks. We want our snowbanks to be removed on time. We want our freeze-thaw cycles to be taken care of with proactive maintenance, which it can be if it is proactive. These are the things that I think would be extremely powerful to advocate for, and it's coming very, very soon to that committee. So I'll just leave that there. I don't know if there's others, Anne or Laura, just in general, is there something in particular we should all be advocating towards that could really help in the short term that you think maybe could use a boost?
Well, I've got to put in a plug for affordable housing as much as the city can do on that, and safer and better affordable housing. That's if you look at what we call Maslow's hierarchy of needs, if you don't have housing, the rest of your life is pretty miserable. And I have had a number of patients get rent-evicted and not be able to find housing locally that they can afford at all. And so a number of them have moved out into the periphery, like up the valley and places like that, where there are no family doctors, where there are no services. And so it's actually kind of tragic. So if there were more housing, that wouldn't happen.
Absolutely, great point. And the city, unfortunately, we're investing record amounts in new affordable housing, and that's only $15 million a year. And if you know about housing, that doesn't get you very much. So the other orders of government may assist, but we need to up our own affordable housing investment. We could spend hundreds of millions on new roads, and yet we're not putting enough into affordable housing. I'd argue that's likely more important than expanding our roads, which doesn't tend to work. So great point. And affordable housing also saves the city money in terms of the services it offsets. If you're getting people that are able to be off the street or living precariously, this is something that can really help people into the future. There is a new inclusionary zoning policy coming up where if you're a developer and you're putting up a building near transit, it'll say you have to have 10 or 15% of those units be affordable by the CMHC definition. And so we're trying to use that as leverage to negotiate, which is what we're doing at Bank and Riverside right now, because that is not going on enough. There's not enough affordable housing being produced, and developers are making good profits here. They should be giving back to the public good when they're usurping a lot of our zoning rules. And so that is definitely one thing that we're pushing them for. I know Anna Kylitz is also going to be at the end going through some of the solutions. And so in a few minutes, probably about four minutes, we'll get to Anna. And she can go into some of those areas that what folks can do. Anne, did you want to add on this question?
Yeah, I did. Of course, I live in Alta Vista, so I know about Bank and Riverside, and I'm always concerned that affordable housing people get stuck in towers. And I've been fighting so much when we look at some of the Canada Lands opportunities that please could we have lower built housing so that the community can talk to each other? Could we use part of that school, daycare, community centers? They should be much more integrated. Every time somebody votes for a 33-story building, I weep because I don't think that's best for most of the community. Whether it's affordable or not, it seems to be shunting people in one spot, and then people with big mega mansions have their space not untouched in a less dense area. That's one point. My other point is the only way that we can improve the health system is to advocate at every level. We've got a very empathetic, I think, medical officer of health and Dr. Gary Etches. We have a provincial election coming up, and we really want to make sure that the allocations of funds that are received from the federal government are put in the right places for health care. And then we are in Ottawa, and it's a seat of the government, and we can talk to everybody from CMHC, the Canada Mortgage and Housing, to employment and education, employment and social development, the ones that recruit international professionals, the opportunity to be able to move health professionals from one province to the other, so that we can look at the supply side, we can look at valuing health professionals, we can help direct people into new models. It's not a short-term fix, but you have to start somewhere, you have to plan it, you have to put the resources into it. If you have a national strategy, then you have to mirror something at the provincial level, and then at the city you have to work with that. So my planning background says it's a long time coming, but there are a lot of moving pieces if we do it right.
Well, you are incredibly wise, and I think you're so right too about that missing middle housing, right? We were very much a city of single family or single unit homes and large, huge towers, and we need to find that the middle ground, the missing middle, where there's ground floor oriented units, but you can still have multiple units within a lot, but more ground floor oriented, so you can access it more easily. And I think for seniors, that's absolutely important as well. Thank you for that. So I think just do maybe one more question, then we'll get to Anna. So for Dr. Muldoon, to what extent can the environment be used in proactive healthcare? Forest bathing prescriptions in BC. And then Councillor Menard says optimized park use. This helps in preventing cardiovascular disease, diabetes, etc. So to what extent can the environment be used in proactive healthcare?
Well, I think that's a question that answered itself. Yeah, absolutely. I think that, obviously we've got a lot more research coming in on the benefits of being outside, living in communities where there are trees, which is another thing the city can work on for sure, and being able to access nature. We're very fortunate in Ottawa to have a fair bit of green space and a fair bit of nature that's not that far away from us. And I know this isn't a city thing, but it's really encouraging to hear that the NCC is now going to be having shuttles up to the Gatineau Park so that people can actually access that outdoor space. I guess the other thing that I just want to say, when I heard the word environment, I thought you were going in a different direction, but when we were talking about the freeze-thaw cycles and such, the whole climate change issue and its impact on health, and there are both direct and indirect impacts on health from climate change. And I think the city could definitely take some steps there in terms of greening the city so that we'd have both less pollution and less greenhouse gas emissions, through electrifying the OC Transpo fleet and a number of other, initiatives, charging stations for electric vehicles, etc. So absolutely, the flip side of your environment question, I kind of hijacked it there, sorry.
Oh, great answer. I think what we'll do is we'll bring Anna in, and Anna, you can speak to some of what more we can do. If there's other questions that I see that come up that I'll read out, and Anne and Laura can also take them. But Anna, did you want to just reflect on tonight and what we can do?
Where to begin? Yeah, I feel I am not doing full justice if I focus on a couple of burning things for us. But because I find it incredible, all the information that was shared tonight. And I assume this tonight's session is videotaped, so I would like to watch it again myself. Because maybe there's more that we can do. But as you know, Senior Watch Old Ottawa South started small with snowballs, and we grew. We have been existing now for 4 years. And thanks, the leadership has grown. And it's not just me, it is, I'm co-chair, and there is actually a leadership team. I'd like to mention Carolyn Inch, who is very involved in the Health Hub strategy. And there's Terry Hunsley, who is really moving on the housing. It is really incredible, but is developing there, and the membership of our leadership is growing. We have what was already mentioned, the tech team that is working with the National Research Council. One of our members is the Ontario representative. I haven't seen his name tonight, but there's also work being done with Ottawa U and Carleton. So to have a list of that all, I'm afraid I have to refer the participants to the articles that were published in the April edition of the OSCAR and the GLEEP report. Terry wrote a beautiful, comprehensive article on, Canada needs a national, what is it now called, senior strategy, and makes a good listing. Carolyn wrote the article, the gods help those who help themselves, and that says it all. It is, we have to do it ourselves. It is very unfortunate, frustrating, and it is a lot of work to help ourselves. And I feel a bit hurt that really the politicians are not addressing aging in place. And I don't know why not. Maybe I could become a bit paranoid, because we are now looking carefully, Swoosh is now looking carefully at the statistics. There are not good statistics to indicate that we need primary care. They talk about home care and they talk about long-term care. And I have even asked on the CBC the question last year to the politicians: we seniors like to age in place. What can you do? What can Canada do to support us? And the first answer was, we get more long-term care homes. Well, I could just about cry or scream, because we don't want to go to long-term care, especially not after COVID. We want to stay in our homes, but we want to do it safely and wisely. And you gave a list of supports that are available, and I'm glad that you will make your list available to everybody. And Dr. Laura, I think that it is kind of sad to hear that there are not more of you. And but Senior Watch is also trying to do something about that. And now I'd like to actually refer you to an initiative that we have taken, and that is, I think Miles promised to put it online, but it is an email that you can send to your provincial candidates, and it is right to yourself, to the candidates. It is posted, or the question about it is posted on the website, and it is really, what will you do to get more primary care? I don't have the email or the wording in front of me, but please refer to the wording on the Ottawa South Community Association. We have all the information there. And we also, not everybody tonight came from our area. And if you don't live in Old Ottawa South, you could start an aging in place movement in your own community and ask your community association for support. We can help you with getting this going. We have an email address, swoosh@min, and or you can write to swoosh2018@gmail.com. And that's what I like to share. So in wrapping it up, I'd like to thank you, Sean and Miles, and your team, Dr. Muldoon and Ann Good and Stephanie Stewart, and all the participants for making tonight possible. It was the inaugural Older Adult Forum. I feel it was a success. I don't know what we can do better, but I think there was a good exchange of information and question. And yeah, I'm a retired social worker, and we like to empower people. And I feel, you know, that was happening tonight. We become more aware. And I want to thank you all for coming and participating so actively. And I hope, Sean, that you are inspired to organize another forum in the fall. So you'll hear from our team, you'll hear from Swoosh. And I like to, with these words, I'd like to wish everybody a good night. Thank you again very much.
Good night, everyone. Thank you for attending.
My apologies for my slides.
Oh, and it worked out great. Thank you so much for being here. Your wealth of knowledge, Dr. Muldoon, thank you so much. And to Ms. Stewart, who presented earlier, it was a real pleasure. And we'll do this again in the near future. It's so helpful to hear from people in this way. And there's a lot of advocacy that has to be done. So I'm on your side, and we're going to keep pushing on a lot of these pieces: affordable housing, snow clearing, aging in place, the co-housing model. We can do this together. Primary care. Thank you so much, everyone. Take care.